Welcome to Public Forum, a community outreach program produced at North Idaho College on the shores of Lake Coeur d'Alene. Featuring guests from around the globe addressing a wide variety of subjects, Public Forum serves to educate and enlighten. Please join host and moderator, political scientist Tony Stewart, in welcoming today's guest.
We're most pleased to welcome you to a two-week series. From time to time we do 2 or 3 weeks on the same subject because we think 30 minutes is not enough time. And our subject for this week and next week deals with dental care and hygiene and how that's very important in the medical field. And we're having a guest that certainly is highly qualified to address this two-week series. I welcome to the program Sherry Williams. Sherry's a friend going back many years, and Sherry, it's good to see you again, and thank you for being on our program.
Thank you.
She's got wonderful credentials. She worked originally in California, where she was a dental assistant for 8 years, and then she moved to North Idaho. She graduated from North Idaho College with an AS degree, and then she graduated from Eastern Washington University with a BS degree in dental hygiene. And she has taught at that university for the past 23 years in the hygienist program, along with 23 years of private practice. In addition to discussing this issue this week, she's also an inventor, and we're going to talk about next week something that she has invented that's really helpful to dental staff. But again, we'll go into the program for this week, and thank you again for being here. Many people are very diligent about their care of their teeth or having their checkups and all. I think I'll start by saying that what do the data tell us about people and their dental care? I know it varies from person to person, but this is maybe some ideas or statistic about in the field generally now about people and their teeth and their care.
Well, quite a while ago when I was first an assistant, it was not uncommon to see people over 50 with full dentures routinely. Now, 30-some years from then, we are seeing most senior people, even people into their 80s and 90s, with most or all of their teeth. And we in the dentistry field like to feel that it is because of increased access to dental care, an attitude that you need to floss your teeth in order to keep them, and that the teeth are, and the mouth, the oral environment is part of the body as a whole, so what you do with one part of your body affects the other. So it's been an amazing improvement throughout the years.
That's just excellent to learn about, because having your original teeth is a lot better than having false teeth, in the sense that even just what you can enjoy and eat, but also there are health questions.
Yes.
Sherry, give us some examples that how, if one has certain dental problems that are serious, how that can affect physically the other parts of the body.
Well, the obvious one, and one that has come to the forefront in the last 4 or 5 years, is that the bacteria that is found in oral disease, which is periodontal disease, is also found in the coronary arteries of heart attack victims.
Really?
So there's a link between the oral environment and your entire system, your entire body.
Right. Now, oftentimes when people let things go, or they're having a toothache and they ignore it and all, they get very serious infections.
Yes, they do.
How, and of course the dentist will obviously address that, and a lot of times there's techniques they have to do. They can't feel the tooth or do a root canal, whatever. Take us through, if it gets that serious, what are some of if people postpone it, what they may have to go through in addressing the infection?
There are oral infections, and they're involving the soft tissue, the gums, I'm searching for a word, the ligament around the bottom of the tooth. If the invasion is through the gums, then the periodontal problem, or the tooth problem that happens, is that you can get an abscess on the tooth. You can also get an abscess by having a cavity that is so deep, or having a broken tooth that is broken off so deeply that you can get an abscess. So it's in one case it's a dental disease problem. In the other case, it is a periodontal soft tissue problem, that both have the same end to them if you let it go too long, and that is you lose the tooth.
Yeah.
You lose the tooth, and then your other teeth start drifting into the space, and then it changes your whole bite. It may cause you to lose the tooth that was above it or below it, because they bite together to hold themselves in. And there are just numerous problems that can happen that can be solved so easily by simple daily and vigilant dental hygiene care.
Plus, go when you have a problem really quick. Don't let it fester.
Right.
Can, through that really serious type of infection, can it get into the bloodstream?
Yes, that's what I was talking about earlier when I said it gets into the coronary arteries of your heart. The infection can also sometimes can go into your sinuses. There have been infections documented throughout history where even death has occurred. That's obviously very extreme, but even death has occurred from an original infection left untreated.
There seems to be a growing number of people, or maybe I'm just aware of discussions, but having inner ear problems. Is that ever connected with dental problems?
Children, probably not, because those are the baby teeth and they only have those for a few years, but it can feel like it goes into the ear. Also with wisdom teeth, the teeth in the four corners of the mouth that hardly anybody needs to use anymore. We used those back in the prehistoric days when we were eating raw meat and things, and it's just kind of evolved that many people are being born without them. But the inner ear can be, you can get an infection up in your sinus, as I said. The infection can transfer anywhere.
Okay.
It can even transfer to the heart of people with certain medical conditions like mitral valve prolapse, and that is something real you can die from.
Yeah. Now, if someone has a really bad case, we're going to talk about the treatment.
The gory things.
The gory part. People have this fear about going to dentists. They love those needles that they get into their gums. Suppose someone comes to a dentist and they have a really bad infection. The tooth's going to be saved, and they may have to have a filling or root canal, but that won't happen on that day. How do they have to get rid of the infection first?
We have to generally prescribe a regimen of antibiotics.
Okay.
Penicillin is usually the drug of choice. However, many people through the years have become allergic to penicillin through overuse of antibiotics in general. And they have to be on the regimen for at least 7 days to get rid of the bacteria, so that when a root canal is done or a crown is done or the decay is removed, that none of the real virulent bacteria will be trapped inside.
So in the filling, you trap it in there, and
you could, yes.
Very
yes.
serious problems from that. Sounds like I'm dealing with the most serious things first on the program.
Yeah, I didn't think you wanted to get into that.
Yeah, we're going to get very positive about maintaining your teeth a little later. I still have a few more things. Some years ago, I had a wonderful dentist on the program, and the thing that people fear most are root canals. So if you don't mind, we'll pursue that before we get into maintenance. Let's talk about the channels. And so sometimes when one's gone too long, or you've had a filling and it over time deteriorates, or you don't find the decay until it's too deep and too late. Talk about a tooth and the different channels, and why in some cases root canal you only have one channel to do, and others, how many channels, depending on the tooth, how many channels could possibly be needed to be taken care of?
Well, maxillary or upper molars, the teeth in the back, have a minimum of 3 pulp channels. There's one chamber, and it has 3 roots in the tooth, and the nerve goes down each of the 3 roots or up. On the lower molars, you only have 2, theoretically. sometimes extra channels are found once the dentist gets into the tooth and starts manipulating the files that take the bacteria in the nerve chamber out. Sometimes you can find extra ones, which is always quite a surprise. Yes. Now, the premolars have 1 or 2 roots, mostly 1, but occasionally you'll find one with 2, and they can also have 2 channels or nerves going down that have to be cleaned out. And then the front teeth always, unless it's very, very rare, only have 1. So obviously if you have a molar in the top, in the back, if you have 3 infected nerves, then it's going to hurt sometimes a little more than the 1. And it's closer to your brain up here than it is down here. Yeah. And it really does give the perception of having more pain or the feeling of having more pain.
But you're saying that even though normally in the upper areas in the back there's 3 channels, but you can have 4 or 5?
You could have 4. I recently had a root canal, which was not the fun kind, that had 3 in the lower tooth, and there was no reason for a root canal. There was no decay. There was no deep filling. Just the pulp got irritated or overstimulated. Could be because I have diabetes and I don't fight infection off as easily. And I ended up having 3 and a lot of pain medication and antibiotics and steroids, which doesn't happen very often. But right. If it's going to happen, it's going to happen to somebody you know, and that's why it happened to me, I guess.
As someone in the field, in the dental field, and as a faculty member teaching in the field, maybe this is helpful to our viewers, even though you're obviously very knowledgeable and sensitive about that, it's still, even with good treatment, there can be things happen. So
sure.
The person doesn't always have to feel like this only happened because I didn't do certain things.
No. A tooth can be cracked, a root can be cracked, which is almost impossible to see on an x-ray. 1 in 100 chances that you could actually have the camera at the right angle to actually see the crack in a root, or it could be because of deep decay, as I said before, or because of periodontal disease. And each tooth is different. You never expect one to behave exactly like the other one. Okay. And I've had a really positive experience with a root canal too, okay. So that I know that.
I got to tell a quick story. A wonderful dentist on the show, as I said a few years ago, a very burly type man came into his office, very strong, muscled man, and had a toothache, and they examined it, and the man thought for sure it'd just be a filling. And when the doctor told him it had to be a root canal, he grabs his hands on the seat, the knuckles turn white, and he says, "Oh, doc, it's not hurting much at all anymore. I know a filling will suffice." And the dentist said, "No, it's going to be a root canal." So it's, let me pick another way, and then we'll go on another subject. So people aren't so frightened about doing that, and I've gone through this experience. Most dentists are so sensitive and thoughtful that there's enough medication given to where even when you go very deep, you don't feel it. And if you have to go all the way down, sometimes the dentist will ask, "Do you need more medication?" In other words, you tell the dentist to stop, and so does that help?
Oh, it helps greatly. Before it was the white knuckle thing, dentistry evolved from barbers, actual barbers that cut your hair. That was the evolution because they had the chair, and while they were in there, "Here, I'll take that tooth out." Just in the years that I have been involved with dentistry, the anesthetics have become quicker acting, more profound. We've developed ways in dentistry and places in the oral environment to give injections or shots, as everybody calls them. The needles are thinner. Everything is used once and then thrown away for that.
That's very essential.
Very essential. And yes, it doesn't have to be a white knuckle trip anymore. We have nitrous oxide, commonly called laughing gas.
That can be tremendously helpful if you have a low tolerance for pain.
Tremendously helpful. Even in dental hygiene, which I am personally involved in is we now, as dental hygienists, use anesthetic for deeper cleanings, and sensitive people, teeth that are sensitive because you've brushed them too hard or the gums have receded. There's all kinds of things you can do to help the patient.
And then on the needle issue, I noticed that, and I don't think this was true when I first started as a young man, but they place something on the gums before the needle goes in, and that really makes a difference.
That's a topical anesthetic. It's very concentrated, and it can be left on from 30 seconds to 2 minutes, depending on the brand you're using. That numbs the outside of the skin, so you don't feel the initial penetration of the needle. And going slow when giving an injection is probably the biggest help of all, because the anesthetic, which obviously squirts out the end of the needle, has time to dissipate in the body better when you go slow, so it doesn't push on a micro level, push the cells out of the way quite so fast, and the perception of pain is not there.
Next week on the program, in addition to your invention, we're going to talk about the training of dental hygienists and also some of the things that dentists go through. But let's talk a little bit about, we got the time to do it, and we can continue next week, but I got into the more, I guess, areas that is great concern to patients, but let's talk about preventive care. And so, especially when, even children, of course, and young, but when you have your second set of teeth, let's start with first home maintenance of the things you can do that could be helpful, that you'll have fewer trips to the dentist.
Well, starting at an infant level or starting at an embryonic level, you can take the mother can take fluoride supplements.
Really?
While the child's teeth are being formed. The mouth is the first place that an embryo basically starts, that gets differentiated. And babies, infants, and embryos are forming teeth during the mother's pregnancy. And, of course, everything the mother eats gets spread out and all of that to the child that she is carrying. And the fluoride will actually be incorporated into the teeth as the child is in the womb. Now, toward the end of her pregnancy, the permanent teeth are even starting to form in the child's mouth. So immediately you have fluoride being incorporated into the teeth, which causes the enamel on the outside to become harder, more acid resistant, and they can grow up. They can continue fluoride from the time they're 3 months old, or 6 months old, after birth until they're 14. They can continue to have systemic fluoride, which will continually be incorporated into the developing teeth.
Now, how do you apply that? Is it through...
Well, for the mother, you can just take a supplement. For the baby, it's given in usually a bottle of water or juice as drops.
Like from 6 months up to 14?
Well, 6 months to about 2 years. And at 2 years, they have teeth,
right.
And they're baby teeth, and they can actually take a little chewable tablet.
Okay.
And it is, it's dosed for how old the child is and how heavy the normal child is.
So it's not like in toothpaste or whatever you just...
Oh, it has toothpaste, but that's not systemic.
And that's not as effective.
Right. The things you swallow, the things you drink and eat that have fluoride in them are incorporated into every bone and calcified part of your body. The fluoride in the toothpaste and the swishes and the fluoride that children and adults receive at the dental office with the little mouth trays is a topical application. That will last a month to 2 months, 3 months. It'll just give kind of an umbrella protection of the teeth in the mouth. So, of course, the more you drink water with fluoride in it, the more you use toothpaste with fluoride in it, the more you eat vegetables with fluoride in them, that's going to give a systemic effect. Everything you brush with or spit out of your mouth or don't actually swallow will give you a topical effect.
Now, bottled water, which everybody's doing now, because they're, not everybody I should say, but an awful lot of people, because of things they're concerned about in water. Does bottled water have the fluoride in it, or can you get it with it?
Surprisingly enough, I just learned about 4 weeks ago that there is a water company here in Coeur d'Alene. Their brand of water is called Trinity, and it has fluoride in it. And that's an amazing thing for North Idaho that has no fluoride in it, in its water. I think southern Idaho, extreme southern Idaho does, but North Idaho, for years, the dental community and the medical community have been trying to get a fluoridation issue passed that seems to fail, but now this gives the people that wish to purchase this.
I just read yesterday some city here, some community is going to put fluoride. Now, I believe it was Post Falls. I read something, I'm not sure.
Okay, I didn't get to see that, but that would be wonderful. Decay in children's mouths we are one of the highest decay rate for children in the nation.
Now, for older people who are beyond all those ages, is it still wise to continue to have fluoride? Does it help, or is it too late?
Well, it's not too late for the topical effect. It won't help for the systemic effect, because by 25, most of your bones and hard parts of your body have already been formed. But certainly the topical applications in the dental office are very much used for people who have receded gums, and therefore they get cavities on their root surfaces where there is no enamel. They have it for sensitivity. It's also very useful to stop rampant decay, because an adult will, as my husband does, but drinks coffee with a half a pound of sugar in it.
Sweets are not a good idea.
Sweets are not a good idea, no.
I just have to have a little humor and say I went to my hygienist, and she, some years ago, a different one I have now, the one I have now is wonderful, but she was too, and she said to me, "You're going to need to quit eating sweets." And I said to her, "That's not on the table for discussion, and if I give up sweets, then I'll have false teeth and have sweets." So there's a limit how far you can go with your patience.
That's right.
But anyway, that is all really good advice. Like milk and calcium, does that help at all?
Yes, it does, but the worst misconception that anyone can have is thinking that milk is going to make your baby's teeth strong and healthy, which it does, but never when it or juice is given in a bottle that the baby goes to bed with, because all night long the teeth are bathed in milk, which also, milk is wonderful, but it also has a sugar in it.
Oh, yeah.
Lactose. And lactose is just as cavity-causing as apple juice is, or sucking on hard candies, because it does act as an acid to penetrate the enamel or the root surface of teeth, and babies by 3 will have black teeth because of decay.
So later in the afternoon, evening, it's very important to understand about babies.
Yes.
Another question I have is that for everyone of all ages, we mentioned sweets already. What are the best things to avoid to protect your teeth? Other than
Food.
sweets, food altogether.
No, I really don't think you have to avoid any foods. You just have to avoid the frequency of them. If somebody sucks on cough drops all day long, you're going to end up with rampant decay. If somebody eats crackers that are a soft, sticky substance and doesn't rinse their mouth out or floss or brush routinely, that will cause cavities. Cavities will be caused anytime acid will be produced anytime you eat anything besides water. which is a normal body function.
Right.
And the more you realize that, the more often you do that, then the more chances your teeth are set up with an acid attack.
It's like chewing gum all day with sweet in it and all. That would be constantly sugar.
And there are chewing gums that are sugar-free.
Yes.
There are sugar-free substances like xylitol that are a natural occurring substance that actually fight decay.
Right.
But not if it doesn't say sugar-free.
We're getting short on time. We're obviously going to.
Really?
Good news is continue again next week. But another thing on maintenance important is brushing a lot. Would it be most ideal, would it be to brush 3 times a day, morning and after each meal?
Yes, and you have to, of course, regulate that with your daily life. You can't be
Right.
brushing your teeth 24 hours a day. Brushing is very important. The angle of the brush in relationship to your teeth and gums is very important, and flossing, of course. And lots of people will come in and say, I've heard the lecture before, let's just get my teeth cleaned. Well, flossing works most of the time very well until periodontal disease happens, and then you need adjunctive therapy. You need different home care aids and different kinds of toothbrushes and
Brushes and also the flossing, but then there's also, I don't know what to call them, but you can get them at the dentist, and they're little long things with little brushes around them, and they'll go in at certain places.
those
too.
are Proxa brushes.
Yes.
Those are very good. Those are good for cleaning up to 3 millimeters below the gum surface, as is floss, as is your toothbrush. The problem occurs when it goes over 3 millimeters, when the space between where your gums start and your bones meet that in your mouth is the point at which we have to start thinking about alternative methods for cleaning your teeth.
It's a great point on which to end. We'll pick up next time because I have another question dealing with going to the dentist in relation to below those 3 meters, and we'll deal with that next time, along with your
The numbers.
your numbers, and then your invention. Ladies and gentlemen, I am sure you've enjoyed this program, and most of all, it's been informative, and that's what we're all about, is trying to help you with such things as this issue of your dental care. Please be with us again next week at this very same time, and we will continue this discussion with our guest, Sherry Williams. Until then, please have a good week. I am Tony Stewart.
Recorded on the campus of North Idaho College, Public Forum is the longest-running in-house college production on PBS. Each episode is pre-recorded live and is an educational outreach from North Idaho College. Please join us at this same time next week for another edition of Public Forum on this public television station.